Hello everyone. Welcome to our educational webinar performed by by medical specialist of IVMED Medical Centre and specialist of IVMED Family Agency. My name is Iryna Kapshuk. I will be the moderator of this webinar and answer on some questions for IVMED Family Agency. I want to introduce you our topic of today's webinar. It's frequently asking questions about what is needed to start the IVF or surrogacy program. Our today's speaker, sorry, one moment. Our today's speaker is Iryna Kapshuk, first category obstetrician, gynecologist, reproductologist, candidate of medical science, specialized in assisted reproductive technologies, advises couples on planning pregnancy and infertility, miscarriage, trysts, female infertility. Olha Chaplia, PhD, senior embryologist at IVMED IVF Laboratory, ESHRE certified senior embryologist, 11 years of IVF and genetics laboratories practice. In 2019, got the European certification as a senior specialist. Daria Hudkova, molecular biologist, employee of the andrological laboratory, a specialist in the diagnosis of male infertility. So today we will discuss the general questions about IVF and surrogacy program. My colleague Nadia Davidovska will help us with translation. And so I think we can start. The first question, what documents should be prepared to start the IVF program? With whom should I communicate on my issues and through what means of communications? First of all, I want to say that before you start your IVF program or surrogacy program, we ask you to provide us the medical certificate or the protocol of your previous treatments. It's necessary because doctor needs to analyze it and after can give you advice about further steps, what you should to do and which options will be better for you. If we are speaking about the surrogacy program, which is much more complicated, we require the list of documents, such as copies of your passports with apostille or legalizations, is the original of medical marriage certificate with apostille or legalization, and also the third document we ask you to do the power of attorney. This document is necessary because it gives us a chance to sign some documents on your behalf, and you need to come to Ukraine all the time and be here. Usually we provide you example. You can prepare this power of attorney in your country, but in this case you need to put the apostille or legalization. Or during the first visit we organize meeting with notary where you can have a chance here to prepare this power of attorney here in Ukraine. About the communication, our managers from international department, from IVMED Family Agencies support you during the whole process. We usually use such popular social networks as WhatsApp, Viber, emails also. It depends on you which the most appropriate for you. We create a group where will be included our senior manager, the head of our department, and coordinator who will lead your program. All the time we're trying to support you, to provide the necessary information step by step, and answer your questions. Don't worry, we support you, and you can ask questions and be sure that we will provide you necessary information about your program, about process, about documents, so don't worry. The next question, what sperm tests are required in order to start the guarantee program? Please, our embryologist, andrologist will help us with this question.
Hi, thank you for your question. Usually it's, of course, sperm test and also DNA fragmentation, sperm morphology, and sometimes it depends on result of DNA fragmentation. If it's high, we can do oxidative stress also, but it's not necessary, it depends on level of DNA fragmentation. So only 3 analyses is necessary, so that's all. Thank you.
Okay, thank you. The next one, what examinations are required to be sent to the doctor to agree on preliminary treatment? This is question for doctor.
Какие анализы нужно отправить к доктору, чтобы договориться о, предварительно договориться о возможном лечении? Включите звук, пожалуйста, мы вас не слышим.
Как уже Ирина сказала, главное это, чтобы нужно отправить нам документы, в которых отмечены показания к проведению, причины бесплодия, возможные программы, если проводились до этого. Заключение нужно нам отправить, чтобы мы проанализировали предыдущую историю.
Most important, firstly, you should send us the document that certifies your necessity for a surrogate program. Also, if you had any previous IVF attempts, it would be very useful to take a look at this.
Если планируется стимуляция женщины и проведение программы на собственных яйцеклетках, нужно прислать анализ антимюллеров гормон результат.
If you're hoping to run your own stimulation, and if the patient is the one who from whom we will get the oocytes, then we need the AMH, anti-Mullerian hormone results, to confirm the possibility of own stimulation.
Результаты спермограммы, как уже было сказано, обязательно нужно отправить. И если планируется программа суррогатного материнства, то желательно отправить заключение и возможные показания, которые уже выставлены для проведения данной программы.
Of course, spermogram is also a very important document that we need to receive before we start a program. And if you have decided to go for the surrogacy program, we need the documents that prove that you need the surrogacy program.
Перед проведением программы обязательно нужно проводить общеклинические обследования. Это обследование на инфекции, общие клинические, общий анализ крови, мочи. Но эти все анализы вы можете сделать у нас уже по прибытию на программу непосредственно.
Of course, before you enter any type of program, we need to run general tests. For you, it's the general blood test, test on infections, urine test, etc. But you don't need to worry about that because we can do all of those tests when you already come to us in our clinic. Thank you. Those are the most important issues.
For the answers. Thank you for the answers. So the next one. Are any medical records of infections tests of the biomaterial required? What is the period of relevance, validity of such certificate? Question to doctor.
Существуют ли какие-нибудь медицинские записи по инфекционным тестам по биоматериалу, которые требуются? Какой срок годности таких тестов?
Обязательно перед включением в программу, если проводится программа стимуляции у женщины, то обязательно есть такие обследования, как инфекции, передающиеся половым путем. Они должны быть, срок их действия это 6 месяцев. Это обследование на сифилис, ВИЧ и гепатиты Б и С. Срок действия этих анализов 3 месяца. Эти анализы должен сдавать как супруг, так и супруга.
If a woman is expecting to have her own stimulation, we need to make tests for sexually transmitted diseases. We need to make sure that the person is clear of them. Also, the necessary requirements are to do the infectious test for HIV, hepatitis, and other infections. Those are required to do by both men and women. And the validity of these tests is the first 3 months. And the validity of tests for sexually transmitted diseases are 6 months.
Thank you. I saw that you have questions right now, please. We have our general chat. Feel free to write your questions here. After the presentation, we will return to your questions and our specialists will answer. Thank you. The next one. I would like to ship my embryos to the clinic from another clinic. Where should I start and who can I contact and how can I find out the cost of delivery? First of all, if you want to ship your biomaterial from another clinic, from your country to clinic, to our clinic IVMED, you can contact our managers from international department and we will provide information about about proven IVF courier who will help you to transfer your biomaterial. Because usually when patients ask, we provide the contact. Patients should themselves contact to shipping company to clarify details and sign agreement between patients and shipping company. After that, shipping company will contact with our clinic and clinic in your country and help to organize the shipping process. We as clinic need and require some documents from your local clinic where you store your biomaterial. So we'll communicate with your clinic and also with shipping company. So as you see, it's like a little bit teamwork, and we should be in contact from all the sides. Yes, so if you need this information, you can ask us. And about the cost of delivery, this information can provide the shipping company because they do delivery all the time, and it depends on countries, it depends on transportation. So you need to clarify this moment with shipping company. Thank you. The next question, what documents are required to transfer the material from clinic to clinic? This information will provide our embryologist.
Hello. The most important thing that we embryologists are looking for when you transfer embryos from another clinic to ours is so-called Embryo Acceptance Act. It is created on the basis of official document of Ministry of Health of Ukraine, and it contains all the important information that we can use for a successful subsequent identification and sowing of embryos. So it is about your names, labeling of the straws that we will get, also the important issues about media that was used for embryo freezing and straws that were used for embryo freezing. Basically all the information that is necessary to go on with the appropriate preparation, embryo culture if it's needed, and embryo sowing. Also, we are looking for the results of the infectious disease testing that were done before the IVF treatment, where actually these frozen embryos were created. That is the most important issues. There are quite enough for us to go on. I mean, for us as an embryology lab, sometimes other IVF labs also provide us with some details about sewing techniques and all the others, but maybe our doctors or international department would like to get more information from you. So please, before go on with arranging any details, please contact them. They know everything. Thank you.
Thank you. The next one, how do I plan a visit to start the IVF plus egg donation program? First of all, you can contact with managers from international department because we are in contact with doctor, and for example, we can plan your visit or clarify some details. Ask you to provide again in general. Sometimes we provide for Skype consultation, for example. Sometimes we invite our patients to clinic, so it depends on your possibility, yeah, if you can travel for the first consultation to our country. It depends. Thank you. Could you explain an approximate treatment plan before the embryo transfer? Problems? Nadia, please help us with question to doctor.
Yeah, some troubles with connection. Вы не могли бы объяснить, пожалуйста, приблизительный план лечения до переноса эмбриона в программах донации яйцеклеток?
Спасибо за вопрос. Подготовка к программе донации яйцеклеток у женщины может проводиться дистанционно или у нас непосредственно в клинике. Для этого, если планируется дистанционное лечение, то для этого нужно на 3-й день менструального цикла отправить нам результаты ультразвукового обследования.
So thank you for your question. There are two basic ways in which we can prepare for embryo transfer. The first one is remotely, and the second one is here in our clinic. So if you wish to proceed remotely, you need to send us the ultrasound on the third day of your cycle.
В дальнейшем, если все условия будут соответствовать началу программы, первую часть подготовки будет заключаться в назначении препаратов эстрогенов. Они могут получаться как в виде геля наносить трансдермально, так в виде, возможно, таблетированных препаратов, системный прием.
If the conditions of the uterus of the scans is okay and we are able to start the preparation, we start by choosing the medicines for your preparation. First, we start with estrogens. This can be in gel form or in tablet form.
Подготовка этими препаратами может длиться от 9 до 14 дней в среднем.
The entire process of preparation with this medicines lasts for about 9 to 14 days.
После того, как эндометрий достигнет нужных нам размеров, нужной толщины, к данному лечению будут прибавлены препараты прогестерона, которые могут получаться в виде влагалищных свечей или в виде таблетированных препаратов.
As soon as the endometrium reaches the necessary growth thickness and conditions, we start with the progesterone, and these medicines can be intrauterine medicines or also in form of tablets.
Через 5 дней на 6-е сутки от начала получения препаратов прогестерона планируется перенос эмбриона.
Around the 6th day of counting from the start of the progesterone, of taking the progesterone, we plan the embryo transfer.
Thank you. The next one, how to plan a visit to Ukraine during the COVID-19 borders restrictions. Could you explain how to purchase required insurance? What would cover the COVID-19 treatment? This is one of the most popular questions right now, because in COVID-19 condition, our government really require the insurance, where will be included the COVID-19 expenses. So our clinic cooperate with insurance company Universalna. You can see the link on this company, and this company help us to sign agreement and prepare the insurance for you during your traveling to Ukraine, for example, for treatment. So if you want to find more detailed information, you can follow this link and clarify details. Can I ship my frozen eggs and my husband's together with embryos? In case embryo transfers fail in the surrogacy program, we would like to try to cultivate new embryos in your clinic. Do you think it's better to cultivate them in your clinic or to do it in our country? Question to our embryologist.
Basically, yes, you can. You can ship oocytes, you can ship sperm. As an embryos, they survive well the shipment process. But if you have an option to go on for IVF cycle in Ukraine, to do OPU here, it won't take a lot of time, as Dr. Iryna also mentioned. Or you can go on for OPU in your native country and to produce embryos. It is always better, as for me, to go with embryos, or to go on with IVF at the clinic where you plan to finish the cycle. Because frozen oocytes are quite, they need attention, I would say. Although the vitrification system is very efficient now, still some laboratories lack experience of oocytes freezing due to some legislative movements, or to special social conditions in countries, because in Ukraine, usually oocyte freezing is very proficient. We work with oocytes a lot, but in some countries still it's not a very common practice. So if you think about such an option, please think about sending embryos or coming here for OPU. As for me, it would be more efficient talking about IVF treatment success. Thank you.
Thank you. The next one, I would like to undergo hormonal stimulation in my country and come to Ukraine just for the egg retrieval instead of staying 10 and 12 days in your country. Is that a possibility in the IVF Own Eggs program? If so, please explain how to organize it. Question to doctor.
Мне бы хотелось пройти региональную стимуляцию в моей стране и приехать в Украину уже только на саму пункцию, вместо того, чтобы оставаться в Украине в течение 10-12 дней. Возможно ли такое сделать в программах собственной стимуляции? И если да, то как это лучше организовать?
Спасибо за вопрос. Да, так проводить программу мы можем. Очень часто мы пользуемся такими схемами. Начало стимуляции мы начинаем с 3-го дня менструального цикла. В этот день вы должны у себя по месту жительства сделать ультразвуковое обследование и отправить нашему доктору в клинику.
Yes, thank you for your question. We actually have had quite a lot of practice doing that. So if you wish to organize the process in such a manner, we will ask you to send us the ultrasound on the 3rd day of your cycle.
По результатам обследования доктор может назначить препараты для стимуляции на первые 6-7 дней цикла.
Based on the results that we receive, the doctor is able to prescribe the treatment for about 6 to 7 days of the hormonal stimulation.
Вы можете прибыть к нам в клинику на 7-й, 8-й, 9-й день цикла. Это оптимальные сроки, когда желательно, чтобы наш доктор непосредственно оценил, как проходит стимуляция.
You can come to our clinic on the from 7th to 9th day of your cycle. This is considered the optimal time span in which the doctor should check the development of the oocytes.
На 10-11 день стимуляции будет назначена инъекция триггер для созревания oocytов, и через день будет назначена пункция.
On the 10th or 11th days of the preparation, the trigger injection will be prescribed, and in a day after that, you will have a function. This is the process.
Thank you. The next one, how many embryos do you recommend transferring to increase the chance of successful implantation? Question to doctor.
Какое количество эмбрионов рекомендуется к переносу для того, чтобы повысить шансы успешной имплантации?
Конечно, для повышения шанса наступления беременности лучше переносить 2 эмбриона. Но с другой стороны, если эмбрионы у нас высокого качества и у них была произведена предимплантационная генетическая диагностика на 24 хромосомы методом НЖС, тогда шансы на имплантацию высокие даже при переносе 1 эмбриона.
In general, it is recommended to transfer 2 embryos to increase the chances of implantation. However, if your embryos are of good quality and moreover, if you've done some genetic testing, especially genetic testing NGS on 24 chromosomes, and you know that the embryo is good, then even 1 embryo has a very high chances of implantation.
Thank you. The next one, my embryos were frozen without testing for chromosomal abnormalities, but I still want to make sure that they are healthy. What do you advise to do? Can they be taped and tested on the day of transfer? If so, how many embryos do you recommend taping for testing? Question to embryologist.
Yes, you can sew embryos to be subjected for pre-implantation genetic testing, but obviously not at the day of the transfer. Because nowadays we perform biopsy on day 5. So if your embryos are frozen on day 3, we should wait for 2 or even 3 more days for them to get to blastocyst stage. And also it will take time to perform genetic testing by itself. If we talk about PGD for 5 or 9 chromosomes, these tests will take about 3 to 4 days. And if you talk about NGS testing for 24 chromosomes, this test is quite time consuming, so the result you will get only in approximately 3 weeks after biopsy procedure. So if you have frozen embryos and you would like to go on for PGD testing, it is strongly recommended to sew embryos to get them to be biopsied and to send these biopsies for a testing and to wait for the result, and only after result getting start preparation for transfer. At that moment you will know the testing result, because of course the chance of such a situation exists that among all the embryos that we have, whether it would be 2 or 5, they may be no appropriate for transfer because they can be unhealthy. So please take this into account, and due to this situation, I strongly recommend to sew all the embryos that you have. Would it be 2 or 10, at least you will know their genetic testing result and you can plan your subsequent treatment according to this information. Thank you.
Thank you. The next one, can we sign the documents and necessary papers remotely in order to start the program? I think right now it's very popular questions because as far as we know, conditions of COVID-19 and not a lot of patients here, and most of them want to sign documents remotely. Yes, you can do it. For example, we will send you the necessary list of documents. I mentioned some of them answering on the first question of our webinar, and you need to prepare them. We will prepare contracts for you, for example, send you on your email, and ask you to provide us documents such as passport, marriage certificate, power of attorney if it's needed, and send these documents via DHL, for example. We can receive them, we will have the originals of your documents, and this will allow us to start the program remotely and, for example, even sign because of power of attorney on your behalf. So yes, it's if we're speaking about exactly documents, right? Again, I want to remind it's going to be passports with apostille or legalization, marriage certificate with apostille or legalization, and the power of attorney if you don't want to come to Ukraine, and just give us allow us to sign some documents on your behalf, especially contracts and so on. The next question, what is the waiting time for a donor and how long do we wait for a surrogate mother? When do you start in searching for a candidate? Okay, so what is the waiting time for a donor? When we start your program, we give you access to our online database. You can sign this database and check the all profiles that we have with full information about donor characteristics to find the best one that you like, yeah, and inform your manager or coordinator about which donor you choose. This time, after this, we will clarify information how fast donor can join this program, and when we can start to stimulate the donor. So usually it depends on current donor status, because in our online database you will see that some of them are available right now. Some, for example, can take part in another program and you need to wait 1 or 2 months if you really like this donor and you're ready to wait. For example, some of them can because of doctor's recommendation, not continue to take part in program. So we will see the whole information in our database. The next, how long do we wait for surrogate mother? Our clinic requires that before we start to match surrogate mother for you, we need to have your healthy embryos for embryo transfer, because it can be different cases, yeah, that you will cultivate embryos, and we don't know how many embryos you will have as a result. We don't know how best your program, and do we receive embryo in general. So better when we are cultivating your embryos, and after you, for example, diagnose them, and we will see that we have embryos for embryo transfer. After that, we start to match surrogate mother for you. I think I will answer also on question when we started to research the candidate. Usually, the period for surrogate mother matching, it's up to 2 months. So, thank you. The next question, is it better to transfer fresh or frozen embryos? How does this affect the success of implantation in the donor cycle? Question to embryologist, please.
Generally, it is believed that it's better to transfer embryos in a frozen cycle because the stimulation process may influence endometrial activity, accelerating the endometrial development. So it will lead to improper synchronization of embryo development and endometrium. They just won't be ready to meet at the moment of transfer when we talk about fresh cycle. So nowadays, a lot of cycles go on for so-called freeze-all technique. When we freeze embryos, all the embryos do not do fresh transfer, and then just go for a frozen embryo transfer. But when we talk about donor cycle, there is no practical difference between fresh transfer and frozen one, because in such situation, the recipient doesn't go through hormonal stimulation for super ovulation stimulation. So for donor cycle, no difference, but for patients, it is recommended to go for frozen embryo transfer, except situations when you have probably only 1 or 2 embryos, and sometimes it is recommended by a doctor to go on for fresh embryo transfer in order to reduce the overall treatment time and to get the result quicker. And anyway, embryo culture and freezing is also a selection process. If you have very few embryos, you don't have option to select. You just work with what you get. So in order to get the proper answer, it is always better to go on with a doctor consultation. But basically, I guess the general strategy I already mentioned. Thank you.
Thank you. The next one, can I get some additional therapy to improve the quality of my eggs before stimulation? Question to doctor.
Можно ли получить какую-то дополнительную терапию, чтобы улучшить качество моих яйцеклеток до стимуляции?
Да, значит, качество клеток женщины, на качество яйцеклеток женщины влияет много очень факторов. И в течение всей жизни все перенесенные заболевания, все внешние факторы, образ жизни, все это влияет на качество яйцеклеток. И, конечно же, за месяц перед стимуляцией очень тяжело изменить качество клеток.
There's a vast array of factors that influence on the quality of the eggs. So throughout life, when you have some illnesses or diseases, your way of life, all of this, one way or another, influences the quality of your oocytes. So if you want to change something rapidly in 1 month before the stimulation, it's pretty hard to make significant changes in such a short period of time.
Но самыми важными будут 3 месяца до вступления в программу. И нужно постараться в эти 3 месяца исключить вредное влияние, курение, алкоголь. Если есть лишний вес, нужно провести нормализацию веса. Это все очень важно и будет влиять на качество яйцеклеток.
So if you want to achieve the best result, it is best to start preparing for entering the program 3 months before you actually do. So if you have any bad habits like alcohol or smoking, this should be excluded from your life. Also, if there is any extra weight, it's best to bring it to the norm before you enter the program.
В то же время есть данные о том, что прием некоторых препаратов также может улучшить качество клеток.
It is also believed among the doctors that taking some medicines can improve the quality of the oocytes.
Это мультивитаминные комплексы, которые снижают и влияние оксидативного стресса. Это такие группы витаминов, как витамин С, витамин А, фолиевая кислота.
Also, such medicines as multivitamin medicines can influence positively on the quality of your oocytes. Those are vitamin C, folic acid, and other groups of vitamins that are really good to improve the health of your oocytes.
Также можно назначать препараты, такие как инозитол, витамины группы D и мелатонин. Эти препараты также в некоторой степени могут повысить качество клеток.
Also, such medicines as isotonin, melatonin, and vitamin D are very good for your oocytes. So they're also prescribed.
Thank you. The next question. When the first payment in the IVF with a donor X program? Okay, so if we are talking about payments, it depends on program, but usually you should pay for whole program at the beginning. So when you sign contracts for your egg donation program, you need to prepay for 100%. You make this payment, and after we proceed with program as usual. My husband's sperm results are quite poor. Your doctor suggested that we use the sperm chip method. How exactly will it help? Question to embryologist.
Well, I would say it's a question for andrologist, and
Okay.
Probably that would be better to transfer this question to Daria. Daria, welcome.
Yes, hi, thank you for the question. Actually, yes, it's a good option. Sperm chip provides a better process for sperm washing. Sperm chip does not use any stage that harm physically alive sperms, unlike centrifugation, and it also sorts sperm with best DNA and physiological quality. So also this method has a lot of advantages, which can help us before ICSI procedure from bad quality of sperm, sort spermatozoa only with good morphology and motility. So it's a good advice, and definitely we can use it.
Thank you. The next one, if I undergo hormonal stimulation cycle, should I have a fresh transfer in the same cycle, or is it better for me to plan a follow-up transfer visit in the next cycle? Question to doctor.
Если я прохожу сама гормональную стимуляцию в одном цикле, стоит ли мне сделать свежий перенос или лучше в том же самом цикле, или лучше приехать второй раз и сделать перенос в следующем цикле?
При стимуляции, в принципе, можно проводить перенос как в свежем цикле, так и в криоцикле. Это зависит от многих факторов.
When you undergo stimulation, there is a possibility to do a fresh or a cryo cycle, but the possibility of it depends on many reasons.
Как уже говорила Ольга, чаще всего мы предпочитаем перенос в криоцикле.
Usually we recommend to do the cryo transfer.
Потому что много факторов могут влиять на снижение результативности переноса в свежем цикле. Значит, ситуации, когда рекомендуем перенос в криоцикле, могут быть несколько.
So there are several issues that are not perfect conditions in the fresh transfer. So there are several positions when we recommend to do the cryocycle.
Прежде всего, это влияние наших препаратов, которые мы используем для стимуляции, на состояние эндометрия. Это может вызывать преждевременное созревание эндометрия и преждевременный подъем прогестерона.
First of all, when we prepare the patient for function, we also influence with our medicines the endometrium, and we can cause it to be ripe too soon. And this is not the ideal situation for the pregnancy.
Это ситуации, когда мы получаем при стимуляции много клеток, может развиться синдром гиперстимуляции яичника. В таких случаях мы тоже рекомендуем отложить перенос.
Another possible situation is when we stimulate the ovaries and too many cells are extracted. This situation is called hyperstimulation, and in this case, we also recommend to postpone the transfer to one cycle.
А также могут быть показания со стороны эмбриологической со стороны, когда на 5-е сутки мы не получаем бластоцисты, а бластоциста может развиться на 6-е сутки.
Also, this can be done by advice of the embryologist if we see that the embryo doesn't form a blastocyst on the 5th day, and we have to wait for 6 days. So in this case, we can also recommend you to do the cryocycle.
В общем, частота наступления беременности в криоциклах выше, чем при переносе в свежем цикле.
In general, the probability of successful pregnancy in cryocycle is higher than in the fresh cycle.
Но в индивидуальных случаях возможно рассмотрение переноса эмбриона в свежем цикле.
But it's individual, so in some cases, the fresh transfer may be considered as a viable option.
Thank you. The next question, how can I choose a donor? How can I choose frozen donor eggs? Do I have to pay to reserve a donor or eggs? I think it's a little bit similar question as previous. About choosing a donor, as I mentioned, we have online database. So please ask your manager to provide you the access to this donor database. There you can see the current status and also can clarify information about if this donor has frozen cells. You can also ask your manager to provide you this information and clarify how many cells can be stored of this donor in our cryobank. Do I have to pay for reserve a donor or eggs? No, you don't need to pay. You just need to inform us which donor you choose and when you want to start your program. So any additional payment before you choose the donor. What is the approximate number of frozen oocytes do I need in order to get at least 2 embryos for transfer? Question to Olga.
If you talk about day 5 transfer at blastocyst stage, I would recommend to use at least 6 frozen oocytes to be sure that you will have 2 embryos for the transfer. You also should account that not all eggs, even if they're from donor, will fertilize, and among fertilized eggs, only 50% will reach blastocyst stage. Taking these moments into account, let's start from 6 oocytes. Thank you.
Thank you. The next one, if several embryos are implanted at once, and I don't want a multiple pregnancy, can your clinic do embryo reduction? Question to doctor.
Если имплантируется сразу несколько эмбрионов, и если я не хочу вынашивать многоплодную беременность, может ли ваша клиника сделать редукцию эмбрионов?
Да, в нашей клинике мы проводим редукцию эмбрионов, и мы можем предоставить эту услугу.
Yes, you can comfortably undergo such a procedure in our clinic. So we provide such a service where we can reduce the amount of implanted embryos.
Thank you. The next, what medication do you prescribe for preparation for embryo transfer? If I prepare remotely, when should the first ultrasound take place? Again, question to doctor.
Какие медикаменты вы прописываете для подготовки к переносу эмбрионов? Если я готовлюсь к переносу удаленно, когда происходит первый ультразвук?
Спасибо за вопрос. Первое ультразвуковое обследование нужно провести на 3-й день менструального цикла.
Thank you for your question. The first ultrasound checkup should be done the 3rd day of your cycle.
После этого мы назначаем препараты эстрадиола на 9, 12, иногда больше дней, в зависимости от того, какой будет ответ пациентки на применение препарата.
After that, we can prescribe estradiol medicines for about 9 to 12 days, or sometimes even more, depending on the personal reaction to the stimulation.
После того, как эндометрий достигнет размера 8 мм, мы назначаем препараты прогестерона.
As soon as the endometrius thickness is around 8 millimeters, we can prescribe progesterone medicines.
И через 5 суток, на 6-е сутки проводится перенос эмбриона.
In 5 days, meaning on the 6th day, the embryo transfer is carried out.
В некоторых случаях криоцикл может иметь немножко другую схему и другую подготовку можем применить. Это индивидуальные случаи. Например, если у пациентки есть эндометриоз или будет отложен возможность приезда в клинику в фиксированные дни цикла.
Sometimes the preparation is a little different. This depends on each case individually. For example, it can be for the reason of endometriosis. The preparation might be different, or if the person is unable to come in certain days of the cycle, the treatment may be a little different.
В таких случаях подготовка начинается накануне цикла, в котором будет перенос. С 19 по 24 день цикла могут быть произведена инъекция агонистов гонадотропин-релизных гормонов.
In such cases, we start the preparation in the previous cycle. So in the 19th to 24th day of the cycle, the special injection will be made to prepare everything for the further preparation.
В таких случаях цикл более управляем, подготовка может быть проще, потому что это не будут фиксированные дни визита в клинику.
In this case, the preparation is much more flexible because we will not be tied to some specific days in which you should visit the clinic.
В некоторых случаях возможна подготовка к переносу эндометрия в естественном цикле женщины.
In some cases, there is a possibility of the transfer in the natural cycle of a woman.
Но в таких случаях нужен очень четкий ультразвуковой контроль и более частые визиты пациентки в клинику.
But in this case, there is a necessity of making ultrasounds more often, and the patient should be willing to come to the clinic more often for the checkups.
Как правило, удаленно мы такую подготовку не проводим, а рекомендуем такую подготовку только в том случае, если уже если женщина находится здесь в клинике и может производить более частые визиты.
Usually, it's not an option for remote preparation. In this case, if you prefer the natural cycle, you should be here and to be able to come to clinic for the checkups.
Thank you. Thank you. The next, my husband has poor sperm quality. We learned that you do microtesting, testicular sperm extraction in a clinic. How much does this increase the chances of getting spermatozoids for ICSI? What minimum requirements should a spermogram have in order for us to have a chance with testing? How is this operation performed under local or general anesthetic? Daria, it's a question for you.
Thank you for the question. Firstly, the operation going under general anesthesia, and but actually the cause for microtesting is when the spermatozoa are completely absent in the men's material. It's a mechanical obstructive aspermia when there is spermatogenesis going on, but there are no sperm in the spermatic canal. Also, for example, cause could be when the DNA fragmentation higher than 60%, and there are much more reasons for microtesting. But for example, if in men's material, andrologists can find at least couple of maternal spermatozoa, it's better to use to try ICSI process with native sperm and see the result. Also, we in such cases can use the sperm chip. I told before about this method in order to increase the chance of fertilization and postulation rate. And for small concentration, for oligospermia and for steno, we can also use a sperm chip. It's special for small concentration. So. That's all.
Thank you. The next, will you meet us at the airport? How do we get to the clinic? Yes, please don't worry, we provide these services. We just need to know your flight details. You can send your flight details to your manager, and manager will discuss with our driver when he should meet you at the airport. We also provide accommodations, for some types of programs. So our driver usually meet you at the airport and transfer to your accommodation or transfer to clinic. It depends on situation when you should to visit our clinic. The same when you need to visit clinic next time, we also can provide you a driver and he will meet you at your home and transfer to clinic. Thank you for your attention. We have already finished all questions that we prepared. I just want to check our general chat because someone was raised hand. One moment. Yeah, I saw we have two questions. The first one, Alma asked, my clinic is suggesting to freeze my embryo to day 1st. Is that fine? Then send them to Ukraine for further culture into day 5 and do PGD test or better freeze on the day 5. I think it's a question to embryologist.
Dear Alma, I would say that sending embryos to Ukraine for further culture and PGD testing is an option, but I suggest freezing embryos on day 3. Is because embryos on day 1 is basically the fertilized oocyte, and oocytes, they are quite sensitive to freezing process. As they have quite a high ratio of volume and surface. And it may lead to quite impaired reach to the special molecules that provide the safe freezing. So when you have an option, it is always better to freeze in a more proficient studies of embryo development. Day 3 is a perfect one because at that moment you already see that embryos are cleaving. You can grade their quality. You can go on with assisted hatching that may further help for biopsy. And at that stage, embryos survive freezing and sewing very well. That may also not be very good to freeze embryos that are subjected for biopsy on day 5, because it makes the work of the embryologist who will do biopsy more difficult. So if you think about such an option, please consider day 3 freezing, and also take into account the number of the embryos, because if you have a high number of embryos, then probably among them you will find euploid one when you do for PGT. Because even for young patients, there is only like 50-60% probability to find euploid embryo. Euploid means healthy, according to PGT, and this is our physiologic feature. It's not a problem in you only. It's about human race. So please take it into account, and if you have only 1 or 3 embryos, maybe it is better to think about going for frozen embryo transfer and very, very careful care for a subsequent pregnancy, not about PGT testing. That's all.
Thank you, Olga. Alma said you thank you, day 3 it is. So I think she will choose this option. The next question from Susan, questions for when you are done. So you told the embryos, test them and then freeze. Wait for the results and tow again, right?
Absolutely. Yes, this is the general scheme for testing embryos that are already frozen. You saw them, sometimes you culture them if, for example, they are frozen on day 3. Then you do biopsy, then you freeze them. Or if you get blastocysts, you saw them, do biopsy, and refreeze them. But don't worry about it. If embryo is of high quality, it will survive this process without any problem. In our practice, in clinic, in our personal practice, there was quite a lot of pregnancies that occurred after such a embryo treatment. So don't worry. Modern techniques, they really create miracles.
Susan said this will not damage the embryos. Olga, this will not damage the embryos, right? So I see it's important. Okay, the next, with the guaranteed program, how many try using or own embryos before donation? Is I understood correct? In guarantee program, how many try using own before donation? We have a guarantee program with one trial of own stimulation. We do the one stimulation of own with own eggs, stimulate and receive own eggs, fertilize them, and as if we will receive embryos for embryo transfer, yeah, we can start to prepare surrogate mother. If, for example, you see that, for example, as a result, you do not have embryos, or these embryos with bad quality or something wrong, you can proceed further with egg donor. So you need previous to choose egg donor, and we can use these egg cells to cultivate embryos. I hope I answer the question. Okay, thank you. My colleague, thank you for this webinar. I hope we will clarify some moments. Also, for our participants, you can find our contacts on our website. So if you have more questions, please contact us. And join our next webinar, which will be on next Friday. Thank you for your time. Be safe. Yeah, stay home and see you next time. Bye. Thank you.